Hello, everybody. This is Dr. Sue from Purely Pediatrics. There is a lot of discussion about RSV and how it is terribly affecting our community and communities across the U.S. and actually in other countries. I wanted to do a quick update on RSV, when we worry, and how you can best support your child right at home. RSV is an acronym for Respiratory syncytial virus. And what this is a virus, and it's a virus that unfortunately can be a little bit longer in symptoms and can affect children, particularly the younger children, quite severely. Remember, viruses affect everybody differently no matter what virus we are talking about, whether it's COVID or the flu or RSV. So just because your little one may have RSV, or even your older child or adult, we can get it as well. It does not mean that it is a severe illness itself. Many do well with RSV, and the ones that don't are the ones that we want to make sure that we give the support that's needed, often in the hospital or the urgent care setting. So to start off with, RSV causes a significant amount of inflammation in our body. And viruses in general create inflammation. And that is why we create mucus, that is why we get fevers, and that is why we get coughs, wheezes. All of those symptoms are from inflammation caused by viruses. RSV can cause significant inflammation, and this is why with many children you'll see lengthy fevers, you'll see lengthy coughs, and then you can even start to hear wheezing with these symptoms. Wheezing itself, it does mean there's inflammation, but what I want to make sure we talk about is when to worry with these symptoms. There are children that can wheeze that's mild and that we don't need to consider a hospital stay for them. So I will talk about that a little bit later. What I want you to do as a parent is to keep the big picture in mind. As parents, of course, it's worrisome when our children are ill with any type of an illness, let alone something like a possibility of having RSV. So RSV is generally a virus that gets a little bit worse on days 4 to 6. Normally you hear me say that viruses are worse on days 3 to 4, and then they start to do better within 7 to 10 days. RSV is a little bit different, a little bit more of a strength-induced virus with inflammation, and you can see worsening happen on days 3 to 6. And it can take a couple of weeks for those symptoms to fully dissipate and for your child to be back to themselves. So RSV is something that I want to make sure we educate families on, because it can make a big difference for not only how you are feeling about it, how you handle the symptoms with your children, and to empower you to know when things are going in the wrong direction. So first of all, you'll see fevers, you'll see coughs, and you might see them getting worse again on days 3 to 6. And that is something that kind of clues me into RSV, that this could be exactly what we're seeing. Generally, we see multiple family members sick in the same family, especially if there's multiple little ones. They can be sick at the same time generally. And that's another clue in that we're dealing with a viral illness. So again, you'll see fevers, coughs. You'll see coughs that worsen towards the end of the week. Say they're sick in the beginning of the week. The illness symptoms may start to worsen. And then you may start to hear some wheezing. You may start to hear more persistent coughs. You may have little ones that don't want to drink as much or don't want to eat as much. When I worry the most, when parents reach out to me, is when they tell me that their little one is having significant difficulty breathing. And what this means is you lift up the shirt on the infant or the child and you look for increased muscle use. And you'll see the tummy moving in and out significantly. You'll see the ribs sucking in significantly. You may even see sucking in right below the chin at that little area between our sternum and our rib cage, sucking in. When we see these things, this is something I want to keep a close eye with our families. Now, there are times, again, there's going to be mild, moderate to severe increased work of breathing. That's what I call it. And if you are more mild, if your child is more on the mild side and they're acting mostly like themselves and they're drinking well and they're able to vocalize, then that's something we continue to manage with symptomatic care. And symptomatic care can mean nasal suctioning, nasal saline, a humidifier, ibuprofen for the inflammation if they're age appropriate, and Benadryl to dry up any nasal secretions that may be contributing to that cough. If a parent calls me and tells me this, I always ask about the big picture. And if they're acting mostly like themselves and drinking, then I know that we're still okay. If a parent calls me and tells me that they have a significant amount of increased work of breathing, where they're really working hard, those kids are tired. Those kids are laying on the couch and they are not drinking well and they just have a sick appearance. Those are the kids that I want seen immediately. Those are the kids that I worry about the most. If your child's getting tired from breathing too hard and breathing too fast, that is something I want to get seen. Those kids may be ones that we tell you to go to the urgent care or even the ER to make sure that we understand what's going on. RSV is a virus, so there's no cure, but there is supportive care, and sometimes these little ones respond to albuterol treatments through a nebulizer, which means a breathing treatment, the same thing we would give to an asthma a patient with asthma. Sometimes this can hold them down and increase their ability to handle the viral inflammation better, and they can stay at home with use of albuterol. That is something we do right at the urgent care or the emergency room. If you have the ability to really just take a look and communicate with your physicians, whether I'm your physician or somebody else, make sure you lift that shirt up on your child and let your doctor know how hard your little one is breathing. Look at the big picture. Smiling children, playful children are not the ones we worry about. The ones we worry about are the tired appearing children, the children that are not drinking, and the children that our parents are telling me they are not acting like themselves. And this is worrisome. I want to also mention with RSV, I mentioned about the wheezing, I mentioned about oftentimes they'll have significantly runny noses, and that can contribute to the cough as well. So make sure, if your child's old enough, encourage them to blow their nose. That is a super great habit to get into when these little guys need it. And if your child is too young or not able to participate, do some suctioning. The nose Frida is wonderful. Even a blue bulb suction that you can find right over the counter at a pharmacy or a grocery store can really help as well to get some of those secretions out. That can be very, very helpful. I want to talk about the faster breathing too. Oftentimes families will call and say it looks like they're breathing a little faster. And of course you can do this with RSV or any other virus. What I want you to check first is if there's a fever, because fevers themselves can make us breathe faster and harder. So I want you to make sure to manage the fevers on your child, and fevers again through RSV, you're looking at 4 or 5, sometimes even 6 days with respiratory symptoms as well. And that is something I want to make sure that our families know about too. So faster breathing is something I want you to make sure that you look for as well. Check for fevers if you see that. And faster breathing that leads to increased excessive muscle use, an ill-appearing child that is fatigued, that is something that is a big red flag. That's definitely something I want you to reach out to your pediatrician for sooner rather than later. I've been getting a lot of calls about persistent coughs, and these coughs can be very, very frustrating for families and children. Coughs in themselves are not worrisome and do not always indicate respiratory distress. Coughs can be something that can actually be protective for our lungs to make sure our lungs do not get mucus where it shouldn't be. So coughs are something I know that many families are frustrated with, because in our big bigger kids and even in our adults, you'll see coughing, and it can be really a struggle to watch your little one cough like that. But keep in mind, the coughing is something that's not necessarily respiratory distress and does not always indicate a worrisome condition. Ibuprofen can help with this. You can use the Benadryl again. Sometimes the cough, especially if it's worse at night, is due to postnasal drip. The Benadryl can help with that as well. Making sure they blow their nose or use nasal suction is going to be super, super helpful too. And if your child does have any other medical condition that puts them more at risk for RSV, always let your doctor know that they're starting to show symptoms of illness so that your doctor can help manage them with you with close communication. Children that have asthma especially, those are the kids that we want to make sure that we keep a close eye on. And those are the kids that often respond well to the albuterol treatments if you're using them for your child. And that's something your doctor will be able to help you with too. So in the end, keep the big picture in mind for me. If you're looking at your child, they are playful, they are acting mostly like themselves, they've got a cough, they may have some mild, what we call retractions or increased work of breathing with their tummy, they're drinking okay, and you're pretty comfortable, you just know that they're sick, those are ones that we just keep a close eye on right at home. If your little one is showing significant fatigue, they're breathing fast, they're breathing hard where you're looking, opening up their shirt and looking at their tummy and their chest muscles working excessively and they're sick appearing, please get them seen. Reach out to your doctor. Those are the kids that we want to make sure we keep a close eye on and provide medical direction to you as quickly as possible. Thank you so much all. Please remember, reach out to your doctors with concerns. We are here for you. Everybody knows that RSV is rampant. Remember, we still have many other viruses. We still have COVID. So let's make sure we take this one day at a time together and let your doctor help you. Have a great day, everybody. Thank you for listening.